Ever wonder how doctors can see exactly what's wrong deep inside you without ever having to make a single cut? Well, it's all thanks to this amazing toolkit modern medicine has developed. Today, we're going to dive into the incredible science of diagnostic imaging.
Yeah, that's really the big question, isn't it? And believe me, we've come a long way. The whole process has gone from looking at, these blurry shadows to creating these absolutely mind-blowing 3D maps of our inner workings. It has totally changed the game for making a diagnosis, and it means exploratory surgery is almost a thing of the past.
And I mean, just look at this. This comparison says it all. Over on the left, you've got a classic conventional X-ray. It's clear, does the job, but it's pretty basic. But then, look at the right. That's a magnetic resonance angiogram, and it is mapping out blood vessels in just exquisite detail. We have definitely come a long, long way from just looking at bone.
So how do we actually get these incredible pictures? Well, clinicians basically have 4 main tools in their imaging toolkit. Let's break them down. How they work, what they're awesome at, and, what their limitations are.
All right, first up is the OG, the classic, the X-ray. This is the granddaddy of them all, discovered more than 120 years ago. The idea behind it is actually super simple. Think of it like this: a special kind of light, X-rays, pass through the body. It goes right through the soft stuff, but gets blocked by dense things, like bone, and that creates a shadow picture on the other side.
This picture here is a perfect example of what I'm talking about. See how the dense pelvic bones are bright white? That's because they absorbed most of the X-rays. Now look at those dark areas. That's just air inside the bowel where the rays just zipped right on through. Everything else? Well, it just ends up being some shade of gray.
So right away, you can see the trade-off. On one hand, X-rays are fantastic. They're cheap, they're super fast, and you can find an X-ray machine pretty much anywhere. But the downside, as we just saw, is they really struggle to tell different soft tissues apart. And of course, they do use a small dose of what's called ionizing radiation.
Okay, let's switch gears to our next tool, ultrasound. Now this one is a whole different ballgame. The most important thing to remember? Zero radiation. None. Instead, it works kind of like a ship's sonar. It sends out these really high-frequency sound waves, and then it listens for the echoes that bounce back, building a live, moving picture from them.
And this is where ultrasound really, really shines. Just look at the detail you can see in this image of a liver. It's absolutely superb for checking out soft tissue organs. Think liver, kidneys, gallbladder. Plus, because it's all happening in real time, you can actually see things moving, like blood flowing through a vessel, or even a tiny heart beating.
So, the biggest strengths of ultrasound are pretty clear. No radiation, it's inexpensive, and you get that dynamic, live picture. The main weakness? The quality of the image you get really depends on the skill of the person doing the scan. It's very operator-dependent. And those sound waves get stopped dead by bone or gas, so you can't see through them.
All right, now for computed tomography, or what everyone just calls a CT scan. The best way to think about this is like an X-ray machine on steroids. Seriously. A powerful X-ray source spins all the way around your body, taking hundreds of pictures. Then, a computer stitches all of them together into these incredibly detailed cross-sectional slices.
And this slide, wow. It perfectly demonstrates the power of CT. We're looking at a case of acute pancreatitis. You get this amazing, complete overview. You can see the swollen pancreas and all the fluid around it. You just can't get this kind of view from a plain X-ray or an ultrasound. For complex problems and trauma, it's an absolute game changer.
The benefits are immense. You get incredible detail, and it is unbelievably fast. We're talking less than 10 seconds for a full scan sometimes. But, and this is a big but, it comes with a major downside. A significantly higher dose of that ionizing radiation we talked about. And yeah, it's also more expensive. Finally, we have magnetic resonance imaging, or MRI. And let's be super clear about this one. It uses a giant magnet and radio waves, with no ionizing radiation at all. It works by getting the tiny protons in your body's water molecules all excited, and then it basically listens to the signals they give off as they relax back to normal. When it comes to looking at soft tissue, MRI is the undisputed champion, no question. On this slide, you can see a view of a lumbar spine, clearly pinpointing a herniated disc. The level of contrast and detail it provides for things like muscles, ligaments, the brain, and the spinal cord is just simply unmatched. Nothing else even comes close. So its strengths are huge.
no radiation, and that amazing soft tissue detail. The weaknesses are more, well, practical. The scans can take a long time, the machines are really expensive, and that powerful magnet means it's not safe for patients with certain metal implants, like pacemakers. Plus, some people can get pretty claustrophobic inside that tube. Okay, so we've got this absolutely incredible toolkit. But you know the old saying, with great power comes great responsibility. And now we need to talk about the catch, balancing the incredible need for a diagnosis with the potential risks to the patient.
The primary hazard comes from X-rays and CT scans, which use that ionizing radiation. These are high-energy waves that can damage tissue. Some effects are dose-dependent, but some are just random, like the small but very real increased risk of developing cancer later in life.
To put this risk in perspective, let's look at a super common scan. The extra lifetime risk of getting cancer from a single chest X-ray is estimated to be about 1 in a million. That is a very small risk for sure, but let's use it as our baseline.
But now, look what happens when we move to a higher dose scan. For a CT of the abdomen, that risk jumps to about 1 in 1,000. That's 1,000 times higher than a chest X-ray. Now, it's still a small risk in the grand scheme of things, but it's a significant human-caused risk that absolutely has to be taken seriously.
This table really helps visualize the spectrum. On one end, you've got ultrasound and MRI with zero radiation. Perfect. Then you have your very low-dose X-rays. But notice how quickly you climb that ladder into the high and very high dose categories with different types of CT scans. And this is a really critical point from our source material. With the use of CT scans just exploding over the years, there's a serious concern that maybe they're sometimes overused. The source actually estimates that up to 30% of these high-dose exams might not even be clinically necessary.
So, this brings us to the most important part of the whole process for any clinician: justification. How do you decide when the diagnostic benefit of one of these scans actually outweighs its built-in risk?
Well, clinicians are guided by a pretty powerful checklist. Before ordering a scan with radiation, they should be thinking, has this already been done? Will the result actually change how we treat the patient? Does it need to happen right now? Is there a safer option, maybe an ultrasound? And finally, have I explained the clinical problem clearly so the right test is chosen in the first place?
And that leaves us with a final thought to chew on. Our technology for seeing inside the human body is only going to get more and more powerful. So the real art of medicine, then, is developing the judgment to know when to use these incredible tools and when the wisest and safest decision of all is to not use them at all.